If you or a loved one has been diagnosed with ADD or ADHD and you're still looking for help and natural solutions, this episode is for you. Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive Podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. These research reviews, interviews, and episodes are made for you, whether you're a medical doctor, patient, or concerned family member or friend. The goal of these shows is to bring awareness of the importance of taking care of our spine and the impact it has on our health and the hundreds of different health conditions it could cause without us realizing it. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support. Now on to the show. Okay, welcome back to the Upper Cervical Chiropractic Research Show. This is episode 26. I am Dr. Kevin Leach, and today's research is improvement in quality of life, sleep, and attention in a patient with attention deficit disorder undergoing upper cervical chiropractic care to reduce vertebral subluxation, a case report. And this is by Marshall Dickholtz, Sr., and Evan White, published in the journal Upper Cervical Chiropractic Research. So like I do usually, I'm going to go through the episode and we're going to talk about the basics of why the patient was helped with upper cervical chiropractic care. And then I'll go through a little bit of the neurology and a little bit of why, the mechanism and why a patient with ADD or ADHD could be potentially helped with upper cervical chiropractic care. So the case, so the summary is a 19-year-old patient presented to the doctor. He had mid-back pain, low back pain that had been an issue for 5 years. And it was also reported that he had ADD, he had attention deficit, and his father actually said that he's had that for his entire life. So they did, they monitored that as well. They did outcomes to see before and after, and they saw a vast improvement, so they wrote it up in the research. So what happened was the doctor performed an x-ray, an exam and x-ray with the NUCA protocol, the NUCA technique, found that the patient had an upper neck misalignment and underwent treatment. So several outcome assessments were carried out to monitor the plethora of aspects of the patient's life carried out prior to treatment, 1 month into treatment, 2 months, and then 10 months, with a significant improvement steadily as the patient went through care. And the improvements can be seen in chart 1 in the research paper. Sleep improvement was one of the outcomes they noted because it was so significant. Now, in regards to reported improvements, his mother noted his improvement of behavior, cooperation, and completing tasks, including chores at home, music-related activities, and schoolwork in the classes he began at the college. The patient reported resolution of neck, back, and head pain and improved sleep. He no longer feels clumsy and can play his musical instrument again. In regards to interesting neurological findings, the patient had an abnormal visual neurological exam prior to care, which then normalized after care, suggesting the treatment had normalizing effect on the central nervous system, something that we've definitely had a little bit of research review on that on this podcast, and other researchers in the chiropractic profession have been observing this for decades, and the research is starting to show that as well. Okay, for those of you interested in the neurology and mechanism of how the adjustment could have created these improvements, disafferentiation is a potential mechanism and describes one of the neuropathological effects of the chiropractic subluxation. This affects the afferent system of the central nervous system, which is the nerve impulses from the body to the brain as opposed to the impulses from the brain to the body. Problems with disafferentation can affect mechanoreceptors and nociceptors. Now, due to the subluxation's effect of restricting joint motion, this can increase firing of nociception, the A delta or C fibers, and a decrease in mechanoreceptors or the A beta fibers. The proposed mechanism of how restoring proper function of the joint can help with attention disorders is via the abnormal cerebellar input to the central nervous system, preventing normal, harmonious cognitive and affective function. And obviously restoring that motion restores mechanoreceptors and nociceptive input and balances everything. And then we go back to normal. We talk about that. I talk about that all the time with patients in regards to, we're not really treating symptoms here. We're treating what's wrong with the body, and we're correcting it. And then the body knows how to function normally and healthy. We just have to create the atmosphere, the environment for to allow that to actually happen. So some interesting points of discussion. The study used an MEG, that's magnetoencephalography, to measure the frontal lobe change, which is known to be impaired or diminished in patients with ADD, ADHD. Though outcomes, reported symptom improvements, and improved neurological exams were seen, no change in pre-post MEG was shown, which is interesting why that wouldn't change. Both pre and post show abnormally low value in the delta and theta ranges typically seen with a patient with ADD. Patient x-rays showed degeneration of the neck. Also showed calcium deposits in the neck ligaments. Now this is only a 19-year-old man. So that is very young to have this, but it just shows that these degeneration processes and these calcification processes are not just age-related. They happen after an injury and when the spine is compensating to an injury in abnormal biomechanics and abnormal function. And we see this all the time. Though testimonials are numerous, the research says, research documenting these improvements is limited, however, still suggests patients with associated symptoms of ADD or ADHD could benefit from chiropractic care. The author quotes several studies that show benefits with patients with ADD undergoing chiropractic care. So if your loved one or somebody you know has ADD, ADHD, get them to an upper cervical chiropractor. It could be a natural form of healthcare that could significantly help them like it did for this 19-year-old boy. So I'll link the research in the description below so you can have access to it. Please go there, support the journal specifically as they're providing a lot of research, and we want to support them in continuing to help humanity with chiropractic care and upper cervical chiropractic care. So thank you for listening. Let me know if you have any questions in the comments below, and we'll see you soon. Okay, that's it for this episode. So what did you learn that fascinated you or surprised you about the research today? Join or start the conversation in the comments below. Hey, thanks so much for watching. To watch more of our research shows, click or tap the screen right there. To subscribe to the channel, click or tap the screen right there. Until next time, I'm Dr. Kevin Leach with the Upper Cervical Chiropractic Research Show, bringing awareness to conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic. Until next time, take care and take care of your spine. It's the only one you'll ever have.